A baby in Idaho has died from COVID-19. It happened last month. It is the first child to die in the state from the disease. They lived in southwest Idaho. The Department of Health and Welfare is not releasing any additional information about the infant. And this news, of course, is no doubt likely to bring up even more questions and concerns among parents.
So Central District Health hosted a session on the topic of COVID-19 today. Staff answered questions from parents and tried to calm any fears. Our Andrew Bartline was listening in on that meeting. Andrew, what were the major takeaways from that?
Yeah, chief among them, Morgan. CDH says the vaccine is necessary to keep children safe and to protect the rest of the community. CDH Medical Director Dr. Sandy Mudge says children cannot be ignored as we aim to reach herd immunity. She broke it down really simple. The less the virus spreads, the less likely the virus is to mutate. As we've seen from the Delta variant, mutations can potentially be dangerous and more deadly than previous strains. And CDH says vaccination is the best tool available to stopping infection in the first place.
We know that kids can, if they're infected, even if they have a mild case, they can still infect other members of their household, and they can take it to school or their daycare or preschool. So this is a big reason to consider vaccination.
A big concern about the children's vaccine is how it got emergency use authorization so quickly. Typically, it takes years. CDH says 10 to 15 years even for a vaccine to get full approval and then to be administered to patients. CDH says that includes clinical trials, an FDA review, and then manufacturing and distribution. However, with the COVID vaccine, all these steps overlapped and were done at the same time. So amid these clinical trials, the FDA was simultaneously reviewing, making the vaccine a high priority, really sped up that timeline. CDH says the COVID vaccine is recommended for everyone over the age of 5 years old. They did address exceptions to this. Those exceptions include people who had anaphylactic reactions from past medical injections. That could include the first dose, or an allergic reaction to any ingredients in the vaccine.
Well, Andrew, I mean, again, as we mentioned, parents having so many questions, rightfully so. So how is the children's vaccine different than the adult vaccine? I know we've talked about that before, but did anything new come out of the meeting today on that?
The only thing that was new that I noticed that CDH says there's one different ingredient in the children's vaccine. It's called trimethamine. I think I'm saying that right. It acts as a stabilizer to give the vaccine a longer shelf life for distribution. And the children's vaccine, as we've reported in the past, is 1/3 the regular adult dose.
All right, Andrew, thank you.